Welcome to this educational video about leukemia. We are here to shed light on this type of cancer, providing some valuable insights. Please remember, the information shared in this video is meant for educational purposes only and should not be used as a substitute for professional medical advice. Any health-related decisions should be made in consultation with a healthcare provider. That being said, we hope this information will help increase your understanding about leukemia. Let's dive into the details of this disease and its impact on the human body. So, what exactly is leukemia? Well, it's a type of cancer, but not in the way you might typically think of it. Rather than forming a solid tumor, leukemia involves the blood cells. Our blood is a blend of different cell types, all produced in the heart of our bones, in a region called the bone marrow. This marrow acts like a factory, churning out the blood cells our bodies need to function. But when leukemia enters the picture, this factory starts producing faulty products. Instead of creating normal, healthy blood cells, the bone marrow begins making abnormal ones. These misfit cells are like weeds in a garden, growing out of control, infiltrating the bloodstream, and journeying throughout the body. Sometimes they even cluster in certain areas, like unwanted visitors setting up camp. Now, when the bone marrow is busy creating these abnormal cells, it neglects its duty to produce the healthy cells our bodies actually need. This imbalance can lead to a host of symptoms, which we'll delve into in our next segment. Leukemia isn't a one-size-fits-all disease. It comes in different forms, each with its own peculiarities. Some types of leukemia grow at a snail's pace. These are known as chronic leukemias. Others are like a runaway train, accelerating rapidly. These are acute leukemias. And sometimes, a slow-growing chronic leukemia can shift gears, transforming into a fast-growing acute form. The types of leukemia vary, with some growing slowly, chronic leukemias, and others rapidly, acute leukemias. What are the symptoms of leukemia? This is a question that might be on your mind, and rightly so, as recognizing these signs early could be vital. Leukemia often starts subtly, sometimes without any noticeable symptoms. However, as it progresses, it can lead to a number of health concerns. One of the most common symptoms is a persistent feeling of fatigue and weakness. Even small tasks might seem to take a lot of effort, leaving you drained. Another symptom is unusual bleeding. This could manifest as frequent nosebleeds, bleeding gums, or even excessive bleeding from small cuts or wounds. Lastly, a heightened susceptibility to infections is also common. You may find yourself falling ill more often than usual, or struggling to recover from common infections. Now, it's important to remember that these symptoms could be caused by other health conditions as well. However, if you're experiencing them, it's crucial to consult your healthcare provider. They can provide guidance and, if necessary, initiate further tests. Is there a way to test for leukemia? Yes, indeed. The process of diagnosing leukemia involves an intricate combination of tests and examinations. The first step usually involves blood tests. These tests can reveal an abnormal amount of white blood cells, which could be an indication of leukemia. However, a definitive diagnosis of leukemia often requires a more invasive test called a bone marrow biopsy. In this procedure, a small sample of bone marrow is extracted, typically from the hip bone, using a long, thin needle. This sample is then closely examined under a microscope to check for the presence of abnormal or cancerous cells. But diagnosing leukemia is not solely reliant on laboratory tests. Your doctor or nurse will also conduct a thorough examination and ask about your symptoms. They will assess factors such as fatigue, susceptibility to infections, and unusual bleeding. This comprehensive approach provides a holistic view of your health status. These tests, in combination with an examination of your symptoms, can help identify leukemia. Now that we know about diagnosing leukemia, how is this disease treated? The battle against leukemia takes a multi-pronged approach, with the choice of treatment depending on the type of leukemia, the patient's age, and their overall health condition. And remember, each individual's journey is unique, as tailor-made treatments are often the norm. A common weapon in the fight against leukemia is chemotherapy. This involves the use of potent medications designed to kill cancer cells or halt their growth. Chemotherapy can be administered orally or through an intravenous line, often in cycles that allow the body to recover between treatments. While effective, chemotherapy can come with side effects, including fatigue, hair loss, and susceptibility to infections. Next, we have immunotherapy, a more targeted approach. This treatment leverages the body's immune system to fight the disease. Medications used in immunotherapy help the immune system recognize proteins on cancer cells, making them easier to target and destroy. This method has been a game changer in cancer treatment, offering hope where traditional treatments may have fallen short. Finally, there's the option of a bone marrow transplant, also known as a stem cell transplant. This procedure replaces the cells in the bone marrow that have been killed by chemotherapy or radiation. The donor cells can come from different places, including the patient's own bone marrow or another person's. This treatment can be very effective, but it's also a major procedure with its own set of risks and side effects. It's important to note that not all patients will need immediate treatment. In the case of slow-growing leukemias, doctors might adopt a watch-and-wait approach, monitoring the patient closely until treatment becomes necessary. These treatment options, while not exhaustive, represent the most common approaches in the battle against leukemia. The journey might be challenging, but with the right care, many people can lead full and productive lives even after a leukemia diagnosis. Treatment is a crucial step, but what happens after that? What happens after treatment? The journey doesn't end with the completion of treatment. It's crucial to stick to regular follow-ups with your healthcare provider. These follow-ups often involve discussions with your doctor, physical examinations, and blood tests. In some cases, your doctor may recommend a bone marrow biopsy as well. These checks help monitor your health and watch out for any signs of the leukemia returning, which, although we hope it doesn't, is a possibility. It's important not to neglect these follow-ups, as they are vital in ensuring your continued well-being and catching any potential relapses early. Remember, early detection and treatment can significantly improve the outcomes for leukemia patients. Knowledge is your best defense in this fight. Staying informed about your condition, maintaining regular communication with your healthcare provider, and adhering to recommended follow-ups can go a long way in managing leukemia. Stay informed, stay healthy.